السلام عليكم ورحمة الله وبركاته. بسم الله الرحمن الرحيم. In this video, I'll talk about the anatomy of superficial peroneal nerve or musculocutaneous nerve of the leg. And the name superficial indicate that the nerve mainly supplies superficial structure or skin. And the term peroneal indicate that the nerve originates in the peroneal compartment of the leg or lateral compartment. Musculocutaneous nerve. Musculocutaneous term indicate that the nerve supply first muscle and then end as cutaneous branches. Like the musculocutaneous nerve of the arm, it supply first muscles of the arm and terminate as lateral cutaneous nerve of the forearm. The anatomy of any nerve include knowing the items you see in the slide. Origin of the nerve, how it originates, level of origin and root value. Termination, how it terminates and level of termination. Course and relation, branches and distribution, and finally applied anatomy. The superficial peroneal nerve originates as one of two terminal branches of common peroneal nerve. At what level? Just lateral to the neck fibula inside the substance of peroneus longus muscle in the lateral compartment of the leg. As you see in this picture, this is the common peroneal nerve, and just lateral to the neck fibula, the common peroneal nerve terminates by dividing into two branches. Superficial peroneal nerve descend in the lateral compartment and deep peroneal nerve descend in the anterior compartment of the leg. And the root value of the nerve L4 and 5 and S1. The superficial peroneal nerve first descend between the two muscles in the lateral compartment, peroneus longus and peroneus brevis muscle. Descend between these two muscles, and then in the lower part of the leg it pierces the deep fascia to descend in the superficial fascia. So the first course of the nerve is deep between the two peronei muscle, peroneus longus and the brevis, and the terminal part of the course of the nerve is superficial after piercing the deep fascia. After piercing the deep fascia, the nerve descends in the superficial fascia, and then in the lower part of the leg it divides into two terminal branch, medial and lateral branch, which descend superficial to extensor retinaculum and enter the dorsum of the foot. As you see in this photograph, again, this is the superficial peroneal nerve after piercing the deep fascia and then descend in the superficial fascia, superficial to the superior extensor retinaculum. At the distal border of superior extensor retinaculum, the nerve enter the dorsum of the foot. The course and relation of the superficial peroneal nerve can be divided into part in the leg and part in the dorsum of the foot. In the leg, it descends first deep between the two peronei muscle, peroneus longus and brevis in the lateral compartment of the leg, and then at the junction between the upper two-thirds and lower third, it pierces the deep fascia of the leg to reach the superficial fascia. And again, this level of piercing of the deep fascia may be higher, may be lower. It is related to anatomical variation. Then it descends in the superficial fascia, superficial to the extensor retinaculum to enter the dorsum of the foot. And again, as you see this photograph, this is the superficial peroneal nerve after piercing the deep fascia. The superficial peroneal nerve again descend in the lateral compartment between the peroneus longus and brevis and then pierce the deep fascia to descend in the superficial fascia, and then in the lower part of the leg it terminates by dividing into medial and lateral branch, and these two branches descend superficial to the extensor retinaculum to enter a dorsum of the foot. And here these are the two terminal branch of superficial peroneal nerve, and each one divide into two dorsal digital branch. this branch for the medial side of the big toe, and this branch for the two adjacent side of the second and third toe, this branch for the two adjacent side of the third and fourth, and this branch for the two adjacent side of the fourth and fifth toe. The superficial peroneal nerve in the dorsum of the foot. The level at which the dorsum of the foot starts is the distal border of superior extensor retinacle, and the termination of the nerve in the lower part of the leg by dividing into medial and lateral terminal branch. The medial branch divide into two dorsal digital nerve for adjacent sides of the second and third toe and medial side of the big toe. The lateral terminal branch divide into two dorsal digital nerve for adjacent side of the third and fourth toe and fourth and fifth toe. Branches of superficial peroneal nerve. In the leg, it has muscular branch to peroneus longus and brevis, and cutaneous branch is supply the lower anterolateral part of the leg. After piercing the deep fascia, the nerve becomes superficial, supplying the skin of the lower anterior lateral part of the leg. In the foot, it supply cutaneous branch to the dorsum of the foot and toe, and supply articular branch ankle joint, intertarsal and tarsometatarsal joint. This drawing summarizes the cutaneous distribution of superficial peroneal nerve in the leg and in the dorsum of the foot. In the leg, it supplies the skin of the lower anterolateral part of the leg, as you see in this photograph. And in the dorsum of the foot, it supplies all the dorsum of the foot, except the lateral border, which is supplied by sural nerve, and the medial border, supplied by saphenous nerve. And again, it supplies the dorsum of the toe, except the lateral border of the little toe by the sural nerve, and the adjacent side of the big and second toe, which is supplied by deep peroneal nerve or deep fibular nerve. Okay, again, this triangular area, this is the cutaneous distribution of deep peroneal nerve. So the cutaneous distribution of the superficial peroneal nerve, it supply a leg, lower part, anterolateral, anterior lateral, lower part of the leg, this area, and supply dorsum of the foot, except lateral and medial border, dorsum of the toe, except adjacent side of the big and second, and lateral border of the little toe. The cutaneous distribution of the superficial peroneal nerve, lower anterolateral part of the leg, dorsum of the foot, except medial and lateral border, dorsum of the toe, except two contiguous side of the big and second toe, and lateral side of the little toe. And this diagram illustrates the two terminal branch of superficial peroneal nerve, medial and lateral branch, and each one divide into two dorsal digital branch to supply the dorsal aspect of the toe. Applied anatomy of superficial peroneal nerve or nerve injury. Any nerve injury, I have to know three items. Number one, etiology or cause of injury. Number two, effect of injury, motor and sensory. Number three, the deformity result from this injury. And to start with the etiology of superficial peroneal nerve injury. The mechanism of injury is either due to external compression or entrapment and direct trauma. Entrapment is uncommon but may occur at two sites. Number one, site of piercing of deep fascia, either by fibrous compression within the fibrous tunnel or by a large defect. Large defect means defect in the site of piercing of the deep fascia, and this large defect allow herniation of the lateral compartment muscle with exercise. The herniated tissue compress the nerve at this site of piercing of deep fascia. The second site of nerve entrapment is around the ankle joint. A significant cause of entrapment occur with acute or chronic lateral ankle sprains, inversion injury, and the plantar flexion injuries of the foot because of the post-traumatic edema as well as neuropraxia from the tethered nerve at the retinaculum. So around the ankle, the nerve may be entrapped by these two injuries, whether inversion injury or plantar flexion injury of the foot. The second cause of nerve injury is direct trauma. Because of the superficial position of the nerve around the ankle, it is vulnerable to injury from ankle trauma or ankle surgery employing the lateral approach and ankle arthroscopy. The effect of injury, we have paralysis of peroneus longus and brevis muscle or foot evertors, and sensory loss, or maybe pain, paresthesia, abnormal sensation, or numbness along the area of cutaneous distribution of the nerve. The deformity, talipes varus, or the foot is in inversion position when the evertors are paralyzed, so the foot is in inversion position. Thank you for watching, and assalamu alaikum wa rahmatullahi wa barakatuh.